For those that are infected with lots of access to some of these drugs and treatment, how accessible is it?
I would say the access is very good. Like I gave the figures, we are about 85%, of people that know their status having access to medication. So the access is very good. The drugs are available and they are free. But like we said, the issue of stigma, prevents some people from accessing their drugs. Some people live in Kano State and they travel down to Jigawa State or any other state to go and pick their medication because they don't want to sit in the health centers picking up their medications or So sometimes all these are issues, It's not that the drugs are not available, but people are afraid they are to be stigmatized against and they're hiding and all that. And that is why we all as Nigerians, need to work towards eliminating stigma and discrimination. So we need to create the awareness. We need to ensure that we get tested, and that we access care when we are found to be positive.
Okay. Now, ahead of the target, 2030 target of in terms of meeting the 2030 target now of zero infection in Nigeria. How are you working towards that? What should we look forward to in the coming years in terms of tackling this public health issue of HIV and AIDS in Nigeria?
Thank you very much. So like this year's 2024 World AIDS Day theme talks about, we should sustain the gains, and then of course maintain the rights of everyone, everyone to be able to access care. And that rights include children, include mothers, include fathers, includes even the key population, because we do have a key population, and so that irrespective of your tribe, irrespective of your status, irrespective of who you are, you should be able to have access to HIV testing, have access to HIV counseling, have access to HIV treatment, and with special focus on mothers, pregnant women, and children. And how are we doing this? We're not working alone as NACA, National Agency for the Control of AIDS, but we are working with other sister agencies. We are working with other sister ministries. We work with the civil society organizations. We work with lots of non-governmental organizations. We are working with implementing partners and even donor agencies, PEPFAR, Global Fund, to mention a few, and so many others are in the HIV space to ensure that we reach every nook and cranny of Nigeria.
Many thanks, Dr. Ilari. Now, on a final note, like we do on the program now, what are some of the most common misconceptions you've heard or you think people have about HIV and AIDS, and how would you like to address that?
Yes, I think one of the most common conceptions is that having HIV is a death sentence. No, it's not a death sentence. Like I said earlier, we have people that have been living with HIV, and that is why we're saying, please know your status. Do your test, confirm your status so that you know if you need to access medication or not, and if you're negative, please stay negative. So let me just use this medium to educate.
Yes.
Now, of course, the ways you can contract it is sharing sharp objects, like I said, needles, syringes, blades, razor blades, and even sometimes some of the equipment, we use for pedicure, manicure. And, let's try to make sure that we go to safe places, buy our own instrument if need be, the barbing salon, or ensure that these things are sterilized before we use them. Of course, blood transfusion is a major route of transmitting or contracting HIV infection. Our hospital, of course, we're working with the National Blood Services authorities to ensure that every blood is screened before it is given out for transfusion. So that is another method. Of course, like heterosexual relationship and that is why we say use condoms, avoid unprotected sexual intercourse, and then of course from mother to child, and that is why we are passing this message to say every pregnant woman should access antenatal care, every pregnant woman should be screened, every pregnant woman should be on medication if found to be positive for the sake of their children.